Hello and welcome to today's webinar, 10 Essentials for Private Exchange Platforms. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive. Please respond to the email if you would. I'd like to remind you of AHIP's antitrust statement and ask that you reference it in the Handouts tab. The antitrust statement prohibits us from discussing competitively sensitive information. Please keep in mind that you may also ask a question at any time during the presentation by typing your question into the chat box located in the lower left corner of your screen, and then click Send. You can adjust the size of the slides to fit your screen by clicking on the scale button located in the upper right-hand side of your screen. We are very fortunate to have with us today Eugene Sayan. Eugene Sayan, Chairman, CEO, and President of Softheon. As its founder and Chief Executive Officer, Eugene has been leading Softheon's vision and strategic direction to address health insurers, TPAs, small and large group organizations' goals of addressing the ACA mandate challenges, implementing single and multi-carrier private exchanges, integrating with federal and state-based marketplaces, while mitigating the risk and high cost of implementation and ongoing operation through the use of Softheon Cloud. Prior to founding Softheon, Eugene successfully led the big data and process management initiatives for Fortune 1000 companies after his tenure at IBM. At this time, I would like to turn the floor over to our speaker. Welcome, Eugene.
Thank you, Rebecca. And thank you all for everyone joining us this afternoon. And we all know how busy everyone is. If nothing else, I will say probably recovering or recuperating from another open enrollment to be soon, another day or so. And again, thank you so much for joining us this afternoon. We are very much delighted to have you with us. Today we will talk about some overarching concepts as it relates to the exchanges. If you noted that, we kind of struck through, if you will, the word private, because we strongly believe that over the next several years, the public and private exchanges will be converging into this basically a one marketplace, if you will. So before we dive into it, as Rebecca pointed out, I am the founder and principal of Softheon, and Softheon is a 15 years of technology company with its operations and development taking place right here in Stony Brook, New York, and we are a privately held company. Softheon's always been, at least I would like to be, focusing on the emerging trends since our inception. In fact, one of the projects that we have been fortunate to be part of is nowadays called the Romneycare. Back since 2008, we have been a critical part of the Massachusetts nation's first exchange platform and overseeing different aspects of it, let it be from some aspects of the call center operations optimization to the enrollments and premium billing streamlining and so on and so forth. And so with nearly 7 years of experience in health insurance exchanges and consumer engagement and interfacing with the carriers, we have today served nearly 50 or so health plans, helping and partnering with every aspect of consumer-facing exchanges, and that includes the federal and state-based exchanges. And for those of you who have been familiar with Softheon, if not, we would love to have you visit us online. In fact, one of our communication tools that we like to be kind of in the forefront of that information, in the overarching and the noise of information that we are all subject to, our newsletter gives you kind of a day summary in exchanges. This is, again, complimentary newsletter. We will love that for you to subscribe, and hopefully you will see some value in it. What is Softheon? And again, I don't want to talk too much about it, but Softheon is a cloud platform designed with the addressing the specific needs or requirements of exchange operations. And as you can see here, basically, we handle every aspect of the consumer engagement. And to our definition, the consumer could be the member, it could be a broker, it could be employer, or it could be a navigator. And in the wake of the massive data breaches, I'm sure that we all heard about at the Primera or Anthem, it is imperative to assess whether the health plans have the proper operationals or infrastructures in place. As someone told me a long time ago, what made you successful last 10 years does not guarantee your success for the next 10 years. So if you look into the hallmarks of these recent events around the PHI breaches altogether, you'll find that the systems are being far more, or the attacks are being far more sophisticated, and it takes a long time of planning and everything else. So once again, I think that one of the biggest challenges, that the underlying challenge, in fact, this was being the common message that we heard over and over, about the current infrastructures are in place, does not really fulfill the needs of real-time consumer engagements. Again, I would like to make a note of that. Today, do you think that Expedia or Travelocity will be as successful if a consumer had to wait 3 days to receive their plane tickets or hotel reservations to confirm that? I think the answer will be resoundingly no. So we need to have a real-time systems in place. And through our partnerships with, for instance, with Bank of America, we have 6 regional processing centers that handle every aspect of timely fulfillment processes, as well as the processing of the incoming checks, because everything especially in the ACA world, is timely. That can trigger your cancellation termination processes and whatnot. So all these aspects of I will say, technology has to be taken into account, and that was being one of our core areas of focus of what we work for with our health plans. Again, Softheon is a cloud platform. If you peel the onion, if you will, as you can see, I'm not going to go to each and every one of them. What really is not to pay attention, if you will, is the carrier interfaces, and by design we have it in a minimum, so the system as a real-time entity, as the carrier itself. And by the way, the entire cloud technology is all about branding and everything else along with that, so that we want to be able to present the best ultimate experience to the consumer. And that is, of course, all subject to the SLAs and whatnot. So we use the term the Lego blocks. So you can see there's quite a few Lego blocks, and it being a cloud-based platform, we often update these Lego blocks. So what does that really mean? In essence, what we have, or this is not, by the way, Softheon is not the only entity, is what we call the Sabre of health insurance. What we have been doing, what we are seeing is the convergence of the industry in health, especially in the services and delivery model, is the convergence of the cloud platforms. And there are many examples out there, from Go Health to the Bloom Health and many others out there, as the cloud ecosystem is evolving, and the systems like Softheon Cloud enables you to basically onboard into this new era, if you will, while mitigating many of your risks associated with the onboarding experience. And basically, while you minimize, in fact, the barrier of entry, which is the cost aspect of building up these new environments to begin with. So as we speak, within the first year of operation in here, just about a little over, I will say, 16 to 18 months, we have over 1 million lives runs on our platform, and working, again, as I said, with 50 or so health plan partners that we have. And we have processed nearly $500 million in premium payments through our enterprise and our independent payment aggregator platform, as we call it today. We believe the ACA market will continue to basically pull through the growth in exchanges. And we know that basically Accenture has also indicated that over 40 million lives will be basically securing health insurance products through private exchanges over the next 5 years. But if you look into the CBO's analysis, if you will, that over the next 2-3+ years, we believe that the growth will continue to be pulled through primarily the public exchanges. And so that really brings up one strong point that, again, we believe that there should be no distinction between the public and private exchanges. So, in fact, carriers, we urge them to take a more holistic approach, if you will. We call it basically a supply chain transformation of health insurance products and services. So in that context, the carriers really assume the role of manufacturers, and then through the wholesalers like Softheon platforms and other entities out there, the goal is to be able to reach as many consumers through the multiples of retail channels, if you will, and happens to be probably the healthcare.gov. I use the term the Costco of health insurance, if you will, but you will see many other retail outlets will be coming through that platform as well. So in essence is that I guess that brings up to today's topic, and we'll take a kind of a slow progress from this point forward. So we believe the overall, if you look into this, roughly about 40-some million people who will be buying the insurance through the ACA over the next 5, 10, 15 years, whatever that might be. In combined with the 60+ million, nearly we project, we think that even Accenture is a little bit maybe conservative, and just in the same vein, and Mark Bertolini of Aetna projected about 75 million people on combined will be buying basically insurance products. And again, this estimated to be 6 million already insured. They receive their benefits through the private health insurance exchanges in 2015. There will be a trend in excess of 100% annual growth since 2013. In fact, this has been a growing trend. So I think contributing factors will be the increased ACA PPACA requirements. Employer mandate will continue to play a critical role. As some of you may know, I'm sure most of you do, is the effect of the Cadillac tax, as we call the 40% excise tax on high-cost plans, will go into effect in 2018. And this could affect as many as 38% of the large employers and 17% of the all-American businesses. And we'll need to take some actions as a result of it. Moreover, the private health insurance exchanges will provide an alternative to simultaneously migrate from the basically the legacy high-cost plans to the very creative product and services, including like narrow networks, for instance. And we'll talk more about that when we get into the effect or what's called the critical elements of designing product for exchanges in general. Again, I think that the penalties, to be frank with you, will be the major driving force. And if you also look at it, the immigration law, we believe, will also have a significant impact as the newly basically sworn in citizens and the residents will be also another group of constituents will be moving to the both public and private exchanges. As well as you know, there are some many early adapters in the private exchange arena, let it be Walgreens, Walmart, and Time Warners. So there is a massive shift towards the private exchanges. So let's talk about what that is. In fact, like to talk in the word is the eventuality of health insurance exchanges or marketplaces. This is a term that I took from one of our Gartner analysts that basically as we have done another presentation. So the world is moving. It's moving at an extremely faster pace than, in fact, it did yesterday. Well, let me introduce you to your, for our health plan friends on the phone today and joining us on this call. Here's your competition. Your competition is companies like Oscar Health. They are building the next insurance company from their garage, with probably no more than 100 or so people. So this really brings up an exciting point about this. You know, whenever there is a chaos, there is an opportunity. So basically, one of the first essential lesson I think that health plans is to jump onto this exchange, so to speak, wave. The later you wait, the latency factor, if you will, become the late laggers as proverbial, and that will present even a greater challenge as you move forward. And so we have seen the early adapters. Ironically, there aren't that many. If you really look into that, a little over 300 or so health plans currently participating in ACA. Now that's still a small percentage of our health plans, especially the ones that are in the what I will call the regional health plan space, just because of the barrier of entry has been so high, so significant, and there is this basically a wait and see attitude altogether. One thing for sure, Oscar Health will be in your neighborhood. We understand they're big. They're big in here in New York. We know them well enough. We hear that they are going to be in Dallas and Houston and major metropolitan areas. So the change is being triggered with the thought process. Now, one may wonder, how does three young 20s and maybe early 30s come together to build an insurance company? You know, historically, this is not something that anyone will consider, let alone receiving $150 million funding from a venture capitalist. But it is happening. So basically, what we are looking to see is as being pointed out, in fact, by WellPoint. In the last quarter of last year, they made an announcement that lost 300,000 people from their small business plan membership, and that's about a total of 1.5. So it's about nearly 20% of their small group membership is basically eroded as a result of the sweeping changes in the consumer sentiment. So the health plans, the strategy, need to start thinking about generating new revenue opportunities. Traditional means of retaining and acquiring members is no longer the preferred method will be. How do you retain your existing groups, and how do you increase the lives cover? The overall consumer satisfaction, there are many surveys being done, and historically the health insurance companies are all the worst performing sector when it gets down to consumer engagement. That trend has to be turned around altogether, and ultimately the consumer needs has to be met. So how does Oscar build this platform? I can assure you, Oscar or companies like Oscar's, where companies like Softheon, for instance, working with 50 or so health plans, you can prefer to choose the model of buying and building an operating model, and we know that that has been basically a nevertheless it was very successful in the 80s, 90s, maybe early 2000s. But if you look into any other industry, that the adoptions of cloud has been basically the game changer. And ironically, for those of you who has been doing a direct enrollment, for instance, it is an ideal application of a cloud-based solution. Today, on behalf of every one of our 50-plus health plans, we connect them to the Federal Data Hub using the cloud computing platforms. So we talk to our fulfillment platform vendors through our cloud interfaces. We don't host the data, and data is basically in a secure, in a probably the most accessible yet secure ways that can be accessed. And by the way, that your cloud partners, technology partners who are using a cloud technology will not be, in fact, before you even ask, they will be volunteering for an SLAs about their uptime availability, just as Softheon. Our cloud platform has an uptime guarantees of 99.95%. And, to be frank with you, I know I have a lot of probably IT background friends on the phone with us today, and I will challenge them if they were able to meet an internal SLA at that level altogether. Cloud gives you the capability to really put together an ecosystem that similar-minded or like-minded vendors or organizations can come together and provide an uncompromised solution at the size and scalability. Again, so that brings us to our next essential point, multi-channel retailers. Just as today, you don't hear a Delta CEO saying we only want to sell it on healthcare.gov or lack of a better term, Expedia. Just as Apple doesn't sell it only through their Apple stores, even though they would love to do that. But many of those organizations creating this lifestyle experience for consumer, creating the brand experience for consumer. In fact, that's going to be your money-losing business entity or venture, if you will. And so in that same context, this whole notion of a single carrier, multi-carrier, it basically serves a two different audience. Today, I go to Delta all the time because I'm a freaking flyer. That's where I upgrade my seats. I might be able to make some changes to it. That's where I can redeem my points, where I cannot do those things in Expedia. So the value proposition about Expedia. So what does that mean? Well, it means that health plans must have, again, holistic approach to engaging with consumer at a platform, at a channel or an outlet that they are comfortable with. Consumers are basically has gone to healthcare.gov and FFM and SPMs, nearly 12 million of them. They shopped around based on price, based on subsidy availability. When we move to the basically private exchanges, the big differentiator is going to be things like defined contributions and how you're going to be able to, in fact, tap into the other parts of engagement. One being that I urge you to bring this up to your team members about how we can basically engage with HRAs, for instance, the health reimbursement accessibility. It's not an account. I want to make a very strong point. It is not an account. It's about basically reimbursement of basically employer contributions on different aspects of what's not covered. So imagine that if there is some small deregulation in the HRA space, that will even further fuel the use of those methods of financing to bring more members, more lives into the exchange world altogether. We can talk about the next chain we call a supply chain, as we talked earlier. That at Softheon we are the Sabre of healthcare, and here at least we think we are. So how do we move forward? So as you can see here, there is going to be the members that consumers are basically split across multiple platforms. So what is it that health plans have to do? So ideally what you want to do is, again, create a holistic platform. If you don't have one, build one, acquire one, what we call a wholesaler. You need to build a wholesale operation. You need to be able to basically to design the products uniquely for each and every one of your consumer markets. Perhaps on the ACA market, you want to be a price competitive. You may want to design products around the alternate narrow networks as the latest phenomenon. If you're going to going after the young and invincible, perhaps and high emphasis on catastrophic plans, much high deductible plans coverages. We also think that over the next several years that you will see that even the carriers coming together. In fact, we use the term the Star Alliance. Today you can go on Expedia and you can get on an American, fly to LA. On your return, you might be flying on Delta. Technology is there to make that kind of processing. So in essence, I can basically purchase multiple insurance product under Star Alliance concept altogether that I do not need to worry about it. What that does is for carriers to start specializing in the overall underwriting aspect to it, on their benefit designs, and then the many different aspects of that interfaces. Again, the exchanges will continue to increase the choice and affordability across all consumers, members, employers, brokers, shopping on behalf of their members altogether too. And we believe the web-based entity also is going to be probably the long-term sustainability, addressing some of the issues around healthcare.gov. We believe the current set of operations are not sustainable. In fact, there is not a single exchange that I know that having some budget shortfalls. Recently, we learned about, as you know, last year, Oregon, basically, and Nevada went back to FFM from state-based exchanges after spending so many millions of hundreds of millions of dollars. We hear that the Hawaii exchange might be in the governor's desk. He might be considering moving back. So the challenge here, it's not that what happens on that side on the retail side. What happens is how prepared as a health plan to shift from one channel to another channel. How easy it will be if you are a Hawaii-based health plan to moving from Hawaii State Exchange to the Federal Exchange. So the key thing is this wholesaler concept, as we call it, the roots and then the trunk and then the branches. The roots being that so many different exchanges that you're going to be interfacing with it, and then you have a consistent process, your wholesaler, and then the branches are your retailers, where everything is going to be distributed across the face altogether. By the way, just taking a moment, if you have any questions, you can type into under the Q&A section of your screen. We will be more than happy to address those questions, provided that we have some time towards the end. We will make sure that we do. The next essential element is the fifth element, is the product design. So again, the phenomena that, or common wisdom, so to speak, was in place over the years as health plans, that you basically gone through some serious underwriting processes and benefit design and administration. I don't know how many of the audience are familiar with the term conjoint analysis. Basically, a conjoint analysis is a statistical technique. It's being developed and used by pretty much every major consumer-facing industry. Let it be from a fast food chain to the consumer retailers. So basically, the objective of the conjoint analysis is to determine that what combination of attributes related to that product is the most influential on a consumer. So in essence, with the conjoint analysis, what you do is you come up with a price. For instance, if you happen to be in a Florida market, where do you want to be in the price range? Where do you want to be able to aim the consumer? So you need to be able to have a platform that basically then works off that and works it back to the ingredients, lack of a better term, about the benefits and coverages and so on and so forth. So we're seeing that very creative, narrow and ultra-narrow network definition as the first generation of conjoint analysis. Again, statistical organizations, data-driven organizations like Softheon, in partnership with very few hand-selected underwriting, let it be Milliman's and a few others, we're seeing the industry trend towards really coming out with a product that meets the consumer needs, rather than designing a product and coming up with a price, if you will. So listening to the consumer, underlying message here, when you go down to the product design and implementations. The sixth essential is, we believe, is mobility, mobile engagements. 84%, well, 59% of the population, this number is already inundated because of the way that industry, overall consumer engagement and behavior has been changing so rapidly. But 60% nearly, they use their iPhone to compare products. I'm sure you do that, just as I do. 64% of them, they find the nearest retailer on their mobile phones. Where 80% of the population, they use mobile phones while they're in the store, finding out about the product comparisons, finding a cheaper place where they can get that product after have a chance to look at and feel. So one of our key missions in here about bringing the mobility, for instance. In fact, we feel that it was a lost opportunity if the industry really jumped onto the mobile wagon rather than just even websites. And we're seeing some early signs again of responsive websites for our marketing folks on the phone with us or web developers. But these are still very much. So what happens if you are a broker and you want to be able to show a list of products to your small business owner in their basement where you have no wireless connections or no signal on your cell phone altogether? So we need to adapt to true mobile platforms altogether. And we work with our health plans, in fact, developing technologies around utilizing the payment, for instance, is a great way of engaging the consumer and making sure that they understand the importance of making timely payments, how it will affect their eligibility if we get into the grace periods and then the termination cancellations. These are great tools. A simple pop-up on someone's mobile phone will be 100 times more effective than sending all the letters you want in the world. They don't open, they don't even read it, especially if you're dealing with a younger demographics. Again, the mobile technology has to be a critical part of your exchange operations. Make sure that your vendor, your IT teams, taking mobile into consideration when they roll out their next platforms and next solutions for the consumer. Well, let's tie that to mobile into the term now. It became just as Google. Uber is another, I think that if not already will be part of our dictionary. We call the Uberization or Uberizing the health insurance. There was a study done very recently and asked for consumer about that. Who will be the best partner that you will depend to the small business owners? 50% of those small business owners responded the brokers as they are trustworthy advisors. Next to another 30 or so percent of them, they are benefit consultants. Perhaps if you happen to be on the larger end of the employee spectrum, will be more leaning to the benefit consultants versus brokers. Nevertheless, 80%, basically these two groups are. So we believe the terms of Uberization is that being able to connecting consumers with that brokers in their neighborhood, and so being able to create that synergy. One of the reasons that brokers have been so upset about this whole process is that basically they view the carriers basically launching their website is a direct threat. And there is an unwritten rule, in fact, it's called 10-3-1. It takes 10 phone calls for brokers to set up 3 appointments and to close 1 sales. So basically, the goal of the objective of the industry has to be not a 10-3-1, perhaps a 3-2-1, or better yet, maybe 1-1-1. So every opportunity that you connect a broker with the consumer and serving both the constituents altogether, and that is the key premise, really, if you think about it, we call the Uberization. So again, speak to your technology partners, your IT organizations, and business entities about challenging them to putting together how the best way to engage the brokers in the process altogether. The next element is the data. The data is one of the most critical aspects of it. The single factor of exchange operations not coming up to speed, and from the way the data issues about the integrity and everything else. In real world, or industries like travel and hospitality, is that imagine that the seat availability wasn't a real-time information available to consumer. How successful will that be? Or you have to wait again 5 days to wait for your the hotel room to be reserved and confirmed with you. The real-time system. So here's the biggest problem. The problem is the entire industry has evolved around basically a nightly or batch processing, all the way from nightly 834 processing to the nightly 837s and so on and so forth. That trend has to change. It has to change dramatically. If you have a consumer waiting and shopping on the website, you want to be able to accept their payments and issue their ID cards. And that, because that's what they expect from dealing with other industries. Well, how are you going to do that if you don't have a real-time systems in place? Well, the key thing is here, just as what Sabre does it and what other entities, and so basically your wholesaler division or the responsibility of your wholesale organization is to be able to maintain enough real-time inventory, enough real-time information so that the consumer on the other end of the internet or mobile phone is able to almost speak to that entity as if they're talking to the carrier, the manufacturing plant, if you will. So that is the key assumption in here. As you can see, we have delivered common technologies, two key technologies that as an entity that you need to invest in is called the service-oriented architecture. It is the cornerstone of cloud computing, where the information is basically as a Lego blocks are being able to build upon. It's updated on a nightly basis. It's 100% available to you. You have the complete disaster recovery, business continuity, and so on and so forth. And again, it guarantees consumer satisfaction, whether it be 2 a.m. in the morning, they're looking to make a payment, or at 8 a.m. or 9 a.m., they're looking to shop around, choose a plan. Enterprise Service Bus is a critical element of messaging. It's a messaging-based systems. Again, as the information goes through. Another term that we use, exchanges, is pretty much like basically the airline luggage conveyor belt. When the consumer walks up, you drop your luggage and somehow it disappears behind the counter. And there are through the series of conveyor belts, a series of little sensors, and ends up in the right plane. And that's what that is. That's what your exchange platform. So the basic premise there, we don't want to open up the luggage and see, interrogate, investigate whose luggage that is. So the key things about that, putting the right recording, right messaging protocol, right envelope protocol, so that you don't have to open the box, see what's in it. So the systems be able to push that information, that luggage, from right conveyor belt to the loading up to the right plane, so you don't have to miss your luggages. How annoying it is, even it happens today, very few cases, that we all get very upset about that. So that's what the experience that the consumer wants. That's the experience that I think we want to create for ourselves. The final component is about the last two components is the change and the processes. When we talk about process, we're talking about the change. I don't know what's been your experience with working with CMS and state-based exchanges. There's not a day goes by that a curveball being thrown at you. Oh, by the way, here's a pre-audit file that we have it for you. So what you need to be able to build a platform. So the third critical technology component is business rules, business processes. So combined with these three critical elements of cloud computing, business process management, enterprise messaging, and service-oriented architecture for your computer, for your IT assets. These are the three critical components of technology, and that's what's going to drive your exchange. That's what's going to determine the success and, to a certain extent, the failure of that exchange businesses altogether too. And then the final component is data, analytics. If you are not, ultimately, you will be gathering lots of data. So another lesson that I learned long days, data is dumb. Data will not tell you anything unless you have the right question to ask. So you need to learn the right question to ask. And that's what in fact is a complete feedback mechanism. I can go back to the very first essential about a strategy, about a planned product design. Where are you going to get that information? It's right here. It's a complete feedback. Take all that data, feed back into your product designs to come up with a more competitive products and services, and so on and so forth. Service level agreements, both internal and externally. As the industry, itself, just as financial services, banking, other retail industries has gone through the transformation into this supply chain model, you need to be able to maintain a complete referenceability, complete control. Again, organizations like yours, you use FedEx and UPS for great reasons. That you couldn't do that in early days with USPS. Now they have some capabilities like that, but again, being the sometimes the largest and the biggest, it actually works against you. And I think that we've seen this in every industry. We have seen the worlds of Pan Ams and TWA. For those of you old enough to know what those are, they are gone. Instead, now we have JetBlues. And sometimes being small, being more agile, is in fact that's what will guarantee your success on the long run. And the operational metrics, of course, how successful you are as an organization. We talk about basically a member level P&L. We are able to basically correlate the as a result of our edge server engagement with our carriers. In fact, we take your claims data, we then correlate it against your profit data on the revenue premium side. Then we're able to produce you a member level P&L. Think about that. What a novel concept, right? Well, every industry has been doing this for quite some time. So investing in the right technologies, investing in the right partnerships, and combined with these 10 essentials, we believe that will basically, I will say, nearly guarantee your success. Maybe it's coming in a little longer, in a couple of more iterations, but nevertheless. So at this point in time, we thank you for your time, and I'll turn over to Rebecca for the Q&A session.
Thank you very much, Eugene. At this time, we are going to address some questions that came up during the presentation. The first question asks, can you elaborate on the suggestion that carriers band together to offer their products on the same platform?
Sure. So again, I think that in the context of a multi-carrier exchange, I think we will continue to see a great proliferation. We have already seen a 30+, let alone in a private exchange in the world of AI and so on and so forth. We are also seeing that basically convergence of the web-based entities, as I mentioned already, and Softheon is in fact one of those organizations being deemed or certified to sell 80,000 products. Now, we're also talking about perhaps more of a close alliance. We're seeing that in the co-op market, for instance, having been working with several co-ops, as you know, that 2 years ago, these entities did not exist. Within 2 years, we have been fortunate enough to work with some co-ops with over 100,000 lives they covered within the first year of their operation. So I think that for health plans with similar in business model, strategy-wise, we are seeing that basically a regional exchanges, perhaps, that in fact this was a topic of conversation at the state exchange level when there was a conversation for a long time to bring the states from Northeast to a single state exchange, given that basically the consumers are so fluent in working in one state, living in another state. I think we're going to continue to see those alliances. It happens either as a closed caption. I will call that a kind of the BJs of the world is going to be another one next to the Costco's. And we will also see within the exchange that certain health plans will come together. For instance, imagine that through the concept like Star Alliances, imagine able to offer a national health plan, national coverage for a large organization, where in California, for instance, or in, let's say, Oregon, we might be insuring you under Health Republic of Oregon. That's one of our proudest team Softheon partners. And if you happen to be in let's say, in Texas, we insure you under Austin in First Care. So if you happen to have these two basically location part of your large group, today you have only option, which is go to national carrier to do this. In the future, you will see a lot of data is being brokered across multiple carriers coming together and targeting specifically for that kind of a market that historically they were not able to compete.
Okay, great. Thank you. We have another question that asks, what criteria should health plans and organizations use to develop a long-term and sustainable strategy around exchanges?
Sure. I think the key thing here is really overall, I will call the strategy of how you want to consumerize your system. I'm going to use the term consumerization or consumerism. So I think the first foremost thing is the days of the kind of opening up in a single stop, single shop, one-stop solutions altogether. If you look into any other industry, you see basically this formation of a supply chain value-added business model that basically the plans have to be the manufacturing plans, as I mentioned, the carriers, and then through the right partnership with the wholesalers and retailers and reaching out to the right audience. And the key thing is going to be is basically being agile and understanding and utilizing the data as most efficient way, because the data will determine you the success again or failure of your initiatives. So being very agile, being very agnostic, and having a holistic approach to the health plan products and benefit designs is all going to bring that all together, that success you needed.
Okay, thank you. Another question asks, what are the pros and cons of using cloud infrastructure for private exchanges?
Well, I think that I'll talk more about the pros. I think that the cons, with all due respect, if any one of us is using Facebook, if any one of us is using Google Docs or Gmails or using other products, let it be our online banking and whatnot, we are already pretty much connected, and it's all through the cloud platforms connection. So there's the pros are the cons. I think that is kind of being as the consumer becomes more comfortable with the platform. Again, as I said today, we interface with healthcare.gov over public internet using an encrypted protocol. So the technology is here. Technology has matured enough to get there. So the benefits are really significant. I mean, that again, not just private exchanges, but anything that you do as far as your IT assets, is that the cloud gives you the scalability, especially around the times like, for instance, open enrollment, where you need that elasticity to be able to handle large influx of membership coming in. Well, your cloud vendor under the SLAs, and they'll throw in any hardware necessary, any infrastructure investment necessary, and then we can leverage that investment throughout the year by shifting those assets. That's what we are good at it. We're good at the cloud companies and exchange implementations are good at basically getting that maximum return on the investment. Well, for a health plan, which means that basically you're saving money because we're cloud-based. We don't invest a lot of money in everything else. So those savings are being reflected onto the carriers, and then carriers can reflect those savings to the consumers. Operations, it's virtual. Cloud computing enables you to basically turn into every quiet corner, let it be your bedroom to a hotel room, into your office. You're able to connect easily, safely, and securely, which means you don't have to have, again, a lot of real estate. Again, as I said, Oscar Health, I can assure you, they don't have a big office complex hosting thousands of employees. Everybody is virtual. So there are many, many advantages of our cloud computing over traditional IT infrastructure implementation.
Okay, and we have one final question that asks, what are the hidden risks and pitfalls organizations must avoid when building and operating exchanges?
I think the key thing is basically is to understand where you are from a business strategy. And if I were to, again, as I said, I think that the one thing you don't do involves in Silicon Valley, right? A big, long business plans that you kind of stick to it for the 6 months or a year or 2 years sometimes. The fact of the matter is the consumer behavior is changing so quickly, and there are so many external factors that you need to learn or be ready for it. You know, expect the unexpected. Or you need to have a plan B and a plan C, or you need to have a multi-channel approach to it altogether. So I think that the important things about that, you need to assess your success on a daily basis, and measure the failures on a daily basis and go back and fix it. Again, I think that the as an industry, it's health insurance in general that has been always kind of a little bit of a late lagger as far as adopting new technologies or venturing into different type of product and services. But I think that in light of what's really happened with ACA kind of accelerate this transformation. Now, this was already happening with the high deductible health plans and the other type of private exchanges has been around for quite some time. Cafeteria plans has been around quite some time. What happens is that really what's the biggest change is the technology. The use of technology to truly every day on a daily basis measure the success, learn from the failures, and quick failure and then retry it. And that's really going to be that the kind of I'm going to call it a corporate hygiene, not necessarily think that you come and decide what you do. You come and you just basically do things. It becomes a second nature. And finding the right people, like-minded people, having a strategy, and perseverance at the end of the day kind of makes all the difference.
All right, thank you. I don't see any other questions. So, Eugene, did you have any closing comments before I wrap up today?
Well, I think the one thing that I would love to our audience to walk away from this brief session that we had, hopefully they found it to be, if nothing else, entertaining, is that we are the innovators. Okay? What's really happening today, I think that will have an impact for years to come. We don't even know what tomorrow is going to look like based on what has happened yesterday or what's happening today. I think that there's so much of a kind of uncertainty around what may come out of the Supreme Court decision, everything else. But ultimately, one thing really boils down to is that there are millions of people who need access to health care. The expenditure that we had over the years is not sustainable. Compare the life expectancy in the U.S. with the other developed countries. U.S. was never to be found anywhere in that scale altogether too. So one thing that's great about what's really happening is the innovation coming out of pretty much every corner of the industry. And what is really exciting that when we see young, bright minds applying for jobs at Softheon, saying that I want to be a part of the healthcare. Healthcare is the quote unquote the cool sector now has become. So I think that is a wonderful opportunity. Should not go kind of squander, if you will. And we wanted to cherish every opportunity. There's going to be a lot of mistakes to be made, but I think at the end of the day, those mistakes are going to make us succeed in the long run, just through sheer determination, perseverance, and a little bit of luck, if you will. And the models that are being now played around, built around, let it be from private exchanges to the defined contribution to the ACO models. Exciting thing about each and every one of those concepts and technologies, in fact, can be applicable on a global scale, not just U.S., which is historically the technology around health insurance has been very much a U.S.-specific industry with very little usability or market opportunity outside of the U.S. These technologies now being experimented, deployed to the consumer, has a global appeal. And you're already seeing that organizations buying companies, including the U.S.-based health payers organizations, are buying organizations outside of U.S. with ideas of extending and leveraging their reach. So I think it's great time to be in the healthcare space, and it's great to be a part of the very rapidly changing landscape. And again, it's all about like-minded people coming together. The pie could be a lot bigger. That's why we work rather than compete with most of our friends that historically in a competitive mode. So we are frenemies with them, and we'd like to see a bright future ahead of us. So thank you for everyone for taking the time to joining us.
Thank you so much. And just before I wrap up, we did get one last question asking if today's presentation would be available later on. And yes, it is being recorded, and an online archive of today's event will be available within a few days. and you will receive an email from AHIP asking if you would like to receive the archive. So if you would like to have the recorded presentation, please just respond to that email when you receive it. So again, thank you so much, Eugene, for your wonderful presentation and sharing your thoughts with us today. And thank you to the audience for participating in today's conference. That concludes this webinar. Thank you again and enjoy the rest of your day.